Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. If you have questions or topic suggestions, you can call us at 248-651-5010.
Welcome to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and I am so blessed to have Dr. John Calado in our studio today, and he is so knowledgeable. And a big part of what both of us do, Doctor and myself, is really try to educate and inform our patients and our clients before something happens, because him and I do a lot of response and reactions to things after they happen. And it gets a little bit to a point where you're like, wait a second, why are people letting it get here? Let's talk about what we could be doing prior, right? We're flipping the script. And that's why we're here today with you, because we want to flip the script on longevity, on things that would help enhance our success as we age. And that's exactly why Dr. John Calado is with me today. Now, he's in Michigan, but he's part of a large group, 1,400 across the nation, I believe, right? Called MDVIP.
Right.
So you can definitely Google that, but we're going to give you his phone number at the end. But it's really important to understand that there are tests out there that can help us.
Correct.
And we've talked about those in some other segments. But what I want to talk about in this segment is, for example, the Galleri test was one of them that we talked about, Galleri. So explain to our listeners, we were just talking offline for a second about, if you had breast cancer and it went into remission and you get this test, explain what happens in the body that they can actually see things that could be happening in the future for cancer.
Well, this test can help to identify if a person has active cancer in them right now if they were tested. There are some additional studies that are being done because this is all based on what we call circulating free DNA, cancer cells. All cells die, our regular cells and the cancer cells, and so they circulate in our blood system. So they have been able to pick up these circulating free DNA cancer cells. And so maybe over time, they were going to be able to quantify how much is in the system. Now, it would be nice to be able to screen these people in the future and say that, okay, you have cancer now, and then this blood test maybe can enhance things in the future where then it could still pick up that there's cancer cells that are still circulating in the blood system. But that's still ongoing. And hopefully that's going to be something that they're going to be
will
able
happen.
Yeah, I'm pretty sure that's going to happen sometime in the near future. They've already been able to pick up that material that's in the blood. They just need to be able to quantify how much, and then you need to still try to determine, well, how much is really correlating to certain disease. Is this much correlating to someone who has metastatic disease? Is this just residual that happens for maybe a few months after the person's been treated, or how long does it exist afterwards? Mm-hmm. But I think that's going to help to really define whether we're really effective at treating cancer or not. But right now, it's just indicated for the detection of these greater than 50 cancers if they're active in your body.
Yeah, and they could be active for years, correct?
Yes. I mean, it's trying to pick up the most lethal, the most disabling types of cancers.
Okay.
When you look at its specificity and trying to make sure that you don't have disease, it's only a 1 in 200 that's a false positive. And actually, we're finding out those false positives aren't really false positives because they get retested 3 to 6 months later, and then a cancer shows up. So it's just picking up so early that on our diagnostic tests, like a CAT scan or MRI or a blood test, are not picking it up at that time. And the sensitivity of it, whether you have the disease or not, has been ratcheted down because you can see that a lot of concern can end up happening with this if it picked up all the like cancers. Now everybody would be in panic. It would create a tremendous cost burden to the community if we were picking up these like cancers. It's sort of like having an alarm on your car or your home. Would you want it going off when the wind's blowing or a thunderstrike happens or someone just drove by or someone bumped your car a little bit and then now the alarm goes off? No, you'd want to tone that down. So they're I believe, in the right place. They're identifying the really lethal cancers. They're picking them up early. They're stage shifting these people so they're picking up in earlier stages. That now that confers that they'll live longer, that the treatment will be lighter, that they will be less expensive, and that they can get back to the community.
Well, I gotta believe the insurance companies would be thrilled.
They will. There's a pilot program that's out right now where they're testing it in the Medicare population. So they want to prove that it's going to pick up cancer, that it's going to save in cost all the way around.
Mm-hmm. So it's Galleri.com. So people can go on their website and research how to get that test.
Correct.
Okay. GALLERI.com. What are some other things? And I'm so fascinated by that. Cause like you mentioned, I think it's 1 in 2, is it?
Yeah.
Could have
1 in 2 lifetime risk and I always explain it this way. Think about it when we were in the gym and we'd had to count off teams. 1, 2, 1, 2. And think about like everybody was at 2 is going to end up having cancer in their lifetime. How scary is that?
That's absolutely outrageous.
So,
I totally agree.
So one of the things that we can prevent cancer, and unfortunately, which people don't know about, is that obesity is a tremendous risk factor for cancer. So whatever we can do to try to maintain or decrease our weight closer to ideal, and I'm going to say, be careful of that. Not everybody should be at ideal body weight. Some people really feel better at higher weight than what we calculate as ideal body weight. The closer you are, the better it is. But, everything when we talk about longevity and we're talking about diet and exercise and modifying our stress, there are things that you can do that a lot of us won't do because we're just stubborn. Like, here's an example.
Yeah, give us an example.
If someone wants to exercise, what's holding them back from exercise? Is it because of stiffness? Is it because of arthritis? Is it because of motivation? Is it because of breathing issues? Well, if you're asthmatic, or you have COPD and you're not taking your inhalers or don't want to be on your inhalers, then how are you going to get up and go and do exercise? If you're depressed or anxious, how are you going to be motivated to do that without being on medicines to treat that? How are you going to get up and really move and do your exercise if you're stiff or you're in pain? So any of those things are just going to lengthen the time it's going to take for you to be healthier by delaying you from doing it much more vigorously. I'll explain it more into an extreme form. When we look at people who have stroke, there's a time window that we want to get them back functional as quick as possible, because the longer they end up taking to recover from their stroke, it becomes more permanent, their deficits. So at the start, and I'm going to tell you that as physicians, I think we're very guilty of this. We're not pushing our patients enough to give them the opportunity to be successful in their PTOT speech program. Why are we not treating them for pain? Why are we not treating them for stiffness? Why are we not treating them for their motivation during the time of their stroke, so that we can have them much more motivated and be successful in their rehabilitation and get their deficits reversed quicker?
Well, and you gave me an example earlier about someone who wouldn't get on a treadmill, right? Because they're stiff.
Right. They wouldn't. Well, it's not only just a treadmill. It would be any exercise
walking
equipment.
Exercise. Yeah.
Yeah. They wouldn't want to do it because they're stiff. And so why not take some arthritic medication that makes you less stiff so that you can tolerate doing the exercise? And even, let's just say it does make you stiff, but you take the medicine, but now you could actually do the workout where you're faster at it or much more vigorous at it. So you can actually get more out of that exercise program in a shorter period of time than to be on the treadmill for a longer period of time, because you have to wait until your joints kind of gel out and start to feel like they're moving. But how long is that going to take you? 10 minutes, 15 minutes, 20 minutes to try to warm up, where you could have had that all done ahead of time by taking a medicine that actually helps your stiffness and your pain, enhance your ability to tolerate the physical activity, and also decrease your recovery time from exercise. Because a lot of us will end up feeling achy after it. Those are all negative reinforcers for us. And we need to try to find a way to make everything as positive as possible in terms of the success that we're going to have in working out and dieting and modifying our stress.
Right, right. So we only have a couple minutes left in this segment, Doctor. What would you say would be the number one thing to our listeners that are listening right now that they should be thinking about or doing or take away from this program?
So definitely go into your primary care physician so that they can do the workup that's needed to make sure that they're looking underneath, that there are conditions that, number one, they can help you to be more successful in doing your exercise and diet. And then I wish I had mentioned more about the GLP-1 injections.
We got a minute. Go ahead.
But there's a lot of people who say that I can lose weight by diet and exercise. But then I tell them that's the wheel. There is a new wheel. And the GLP-1 injections have so much benefits that can actually help enhance and make that weight loss much more rapid. So think about it this way. How long would it take you to lose 15 to 20 pounds? Would it take you 2 months, 3 months, 6 months,
6 months? Yeah, for sure. Minimum.
But if it got you to lose the weight in a month or two, then you're actually now moving into a healthier state, because what do we know about weight loss? It helps with reflux and sleep apnea and arthritis and hypertension and diabetes and mood. There's just so many things that it ends up helping. So you could actually get those things to enhance and be done quicker so that you can get on your way to being healthier faster.
So what is GLP-1? Is that like the Alexa?
These are the injections.
Okay.
You've heard the brand names like Ozempic.
Ozempic, that's it. Okay, I couldn't think of it. Yep.
And now the weight loss forms of Zepbound and Wegovy, but there are compound forms. And yeah, there's some controversy with them, but if your doctor partners up with a company who's doing compound forms of it that are good and safe, then you should trust being on those things, because they are tremendously less expensive to do. And
you can do them short term. You can do them
short term. I always tell people that, look, if you're dieting and exercising and you can maintain your weight now, why couldn't you do it if I were able to drop you 20 pounds and do the same and maintain your weight there without the medicine?
Right.
But the thing is that there's not much really downside with the medicine now. And we're finding that there's much more upside with the medication. I mean, it's really clinically indicated for diabetes and for weight loss, but we're also noticing other benefits with it. It's causing not only the person to lose weight, get their diabetes under control, but it's also causing people to be on less blood pressure medication. It does have some tendency, has some properties to prevent certain cancers. It does help to curb a person's crave for alcohol, which, who knows, maybe in the near future it's going to get that indication. It's being used in people with fatty liver disease. And there's so many great benefits on the medication. There's very, very small amount of downside with it. Like people with a certain type of thyroid cancer should not be on it, if it's in the family or them. And if there are side effects related to it, but you have to be judicious with the medicine. And it tends to happen when people are escalating the dose too fast, where they get nauseous and they're vomiting, they're having abdominal pain, and they're having terrible constipation and diarrhea. Because we all need to understand these medicines. What they do really is they slow your gut down to make you full faster and full longer, so you're less likely to want to eat.
Well, and I appreciate you just saying that, because a lot of people don't even understand exactly what it's doing. They're just doing it because they want to lose weight.
Right.
So thank you for that.
Well, I mean, so I look at this as when a person is trying to lose weight regularly, you see their weight going up and down, up and down, up and down. But when you see them on a GLP-1 injection, once a week, you see them just kind of steadily decreasing. There's not really a lot of jagged up and down with their weight. And so there's consistency with that. And for these individuals who are reluctant to be off the medicine, there's nothing wrong with that. They could be on maintenance, and it could just be changed that instead of every week, they could go on a longer regimen based on what their doctor is recommending and how their weight is responding to that. So to me, I look at, you can do the regular diet and exercise, which is the old wheel. The new wheel is doing the diet and exercise and adding a medicine that could tremendously enhance the weight loss, get you to your goal faster, and then you could be off the medication and try to see if you can maintain it without that, and see what the rest of your health improves because of the weight loss.
Absolutely. Absolutely. Well, I can't thank you enough, Doctor. This is so beneficial to all of us, really. And God bless you for what you do every day. Dr. John Calado, I'm going to have him give his office number in case you are interested in reaching out to him. If you're in the state of Michigan, trust me, you should drive to him. If you're not, you can look up MDVIP and get a physician near you.
Right. Yeah, my number is 248-606-4190. I can be also located on the MDVIP website, mdvip.com, and then you could just type my name, Calado, if you want to take a look at my profile.
Absolutely. And we don't want to put fear into you. Our goal is for you to embrace this time of your life instead of being fearful of it. And thank you for listening to Next Steps for Seniors, Conversations on Aging. Hi, I'm Wendy Jones, host of Next Steps for Seniors, Conversations on Aging podcast. Did you know that over 25 million Americans experience bladder leaks? Incontinence can happen to anyone at any time. And when it does, incontinence products are a necessity. But it can cost hundreds of dollars per month to purchase these products, which is why we're partnering with Airflow Urology to help you. Airflow Urology provides medical-grade incontinence care essentials like adult briefs, male guards, catheters, and more for free through your insurance. With Airflow, your favorite bladder control supplies are sent right to your doorstep with discreet monthly deliveries. Customers have reported close to $200 a month in savings with Airflow Urology, and over 2 million people have trusted Airflow. You can verify your insurance benefits by going on and filling out a quick 2-minute form. Check your eligibility. Visit airflowurology.com. That's AEROFLOW urology.com.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.